have been working on this project since December 2015. Healthwatch contacted the community organising team who worked with Youth Action Wiltshire to create the Young Listeners Project, with the aim of giving young people in Wiltshire a voice. We then undertook training and worked to clarify our aims and objectives, designing questions to get the most valuable information about young people's opinions on health services. We also adapted the questions to suit our 3 target groups. So far, we have listened to 174 young people from special educational needs, young carers, and young people with mental health and emotional well-being. We currently have 5 newly recruited young listeners being trained.
For all of our health services, long waiting times were a constant issue.
Young people wanted the option to be spoken to directly or to the person they're with.
Because we are young people, we feel this affects how seriously healthcare services take us.
Most people felt that they weren't being listened to when it came to healthcare services.
Young people felt severely let down by children's mental health services.
School services for healthcare and guidance were not meeting the young people's needs.
People feel like they aren't being given the support they need and that they're just being given medication.
Almost all young people felt respected by staff who treated them as individuals.
Every young person that we have listened to gave positive feedback about their optician.
Most of the young people that we listened to felt happy when going to the dentist, as they got to pick which dentist they went to. This allowed them to pick the one that they felt most comfortable in.
The majority of young people felt reassured by ambulance staff due to their supportive and positive attitude.
Social media stigmatises mental health conditions and who has them. Society says, I'm depressed.
Clinically, I am diagnosed with depression, but I didn't want to bother anyone.
Society says, I self-harm.
I self-harmed, but I didn't want to tell anybody about it.
Society says, I have an eating disorder.
Clinically, I'm diagnosed with an eating disorder, but no one asked me.
How would you feel if help was there but you couldn't access it?
How would you feel if mental health professionals invalidated your concerns? How would you feel if you had to wait 5 months for an appointment?
How would you feel if someone disregarded what you said because of your age?
How would you feel if you were being patronised for asking for help about your sexual health?
How would you feel if you weren't listened to?
On behalf of all the young listeners, we'd like to thank the young people for their contributions and thoughts on this project. We'd also like to thank Healthwatch, the community organisers and Community First for putting this project together.
This project hasn't just allowed us to help the community, but has also allowed us to find ourselves and work on our key skills for the future.
Join us and volunteer for Healthwatch. Be part of the solution.
Would you dance if I asked you to dance? Would you run and never look back? Would you cry if you saw me crying? Would you save my soul tonight? Would you tremble if I touched your lips? Would you laugh? Oh, please tell me this. Now would you die for the one you love? Hold me in your arms tonight. I can be your hero, baby. I can kiss away the pain. I will stand by you forever. You can take my breath away. We are your Healthwatch heroes. Rock down.